Hello, everyone. Welcome to a new episode of Vividh. Vividh, as you know, is a platform to chronicle change journeys of social entrepreneurs, impact professionals, and eventually communities. Today, we have with us Divya, who has started a very innovative platform with a very unique name called Pinky Promise. Welcome, Divya, to this podcast called Vividh. How
Thank you
are you
so
doing?
much. Thank you so much for having me. I'm doing really well, and I'm so excited to sort of share our journey with you today.
Nice, great. So one of the first question I wanted to start with is this is a unique startup, unique space. What was your personal journey that led you to this? Like, because it's a complex space, you're not a medical doctor also, but you're heavily interacting in this space through consultations, both sides, patients on one side, doctors on one side. Like, what was your journey that led you to this?
Yeah, I think it's been quite a interesting and long journey that finally led me to say that okay, you know what, I need to start this. So the inception of the journey sort of was when so I'm a biologist by qualification. So I went to Yale for my biology degree, and at some point there I decided I was going to be a doctor because when I was 16 and I was a young girl in Delhi. I got diagnosed with polycystic ovaries, and it was interesting because all the doctors I spoke to at that point for a potential solution to the diagnosis, they would say things like, you know, "Shadi kar lo, theek ho jayega. This is not a problem for now." But for a woman who's having delayed periods every month and different fluxes in her hormones, who was otherwise very healthy, right? And Shadi was like decades away for me. At that point, it was not even something I was thinking of as a 16-year-old. It was very like a confusing diagnosis. And so when I, as a person who was aspiring to be a biologist and all that, I went and I started looking at a lot of the research papers that existed. And I realized that for every single one research paper that's there on women's health, there are 100 plus such for men's health. And so I said, you know what? I'm going to be a gynecologist. I want to be a healthcare researcher. I want to work on all these things. It was only in my third year of university that I was exposed to something called public health. उस समय मुझे पता नहीं था there's something called public health. I thought you're interested in healthcare, you have to be a doctor.
Right.
But one of my professors, Professor Richard Skolnick, he's actually he was from the World Bank, and he's taken this class on global health that's actually transformed thousands of students at Yale to actually pursue very meaningful careers in public health and health, including in the White House and things like that. And I was, I think, one of those. So once I realized that it's actually your socioeconomic status, your gender, how you're born, all of these things that actually determine your chances of living a good life and dying later rather than earlier, I was like, okay, this is what I'm interested in. And started working extensively with healthcare systems after my graduation. So I worked first with the government of Tanzania on mainstreaming women's access to HIV and sort of drug de-addiction care. And the second thing that I did is I actually started working then in government of Delhi on women's safety and women's health. Then moved to the Britspan Group. Again, did a lot of healthcare consulting across India, Sub-Saharan Africa, Southeast Asia. So healthcare is something that I know very well. And as a biologist, I also have the necessary sort of ability to understand medical literature, understand evidence, and figure out what's good, what's not. And so, interestingly, none of this actually prompted me to start Pinky Promise. What prompted me to start, like the sort of the tipping point for me, if you can call it that, was my own experience. So, when I was in just finishing my MBA at that point, I was pregnant and due to expect my child soon. And I came back to India because COVID tha. I was doing my MBA in the US at Wharton. I came back to India because of COVID. And I started experiencing some complications. Went to a lot of doctors online. And I realized that it took me about a month and a half to get a good diagnosis. No lack on the doctor's part, but the data, the technology, the ability to arrive at quick decisions based on, sort of being available and having that conversation with me was just not there. And so I realized that if I'm with the best of doctors having such a problem, and this is a diagnosis, when I got it, I was like, I should have gotten this in appointment number two, right? I realized that, I can't imagine what the rest of India is going through. And most women, when we actually like look into the data, we realize that young women between the ages of say 18 to about 36, right, the first thing that most of them did, about 76% of them, when they actually had a problem, was they actually went online and searched for their symptoms. And so it made sense to then build a digital first solution for women's health. We decided to leverage AI ML very extensively in our technology because we realized that there's a severe paucity of really good doctors and gynecologists available in India. And then if you had to bring them onto an online platform and ask them to leave their practices and things like that, then it's just not a scalable model. Like you're just going to run out of good doctors very quickly, and it's going to be a marketplace model. And we didn't want that. So we then decided to build an AI enabled platform to provide really quality care at scale, and started building sort of all these like natural language understanding type of models way before LLMs were a thing. So that's sort of the inception of Pinky Promise.
And when you, I was like your point about quality across, right? You might get a diagnosis right, but it takes 2 3 iterations. And
Yeah.
is that a common problem when you see in this space, right? Getting the quality diagnosis first
So you
and
know what?
across.
I mean, quality diagnosis तो बहुत दूर की बात है. And I'll be honest with you because India has about 70,000 registered gynecologists. A lot of gynecological care actually doesn't happen through gynecologists. There are some studies which I was looking at which actually say that the proportion of people who are actually not trained to practice medicine, who are practicing medicine in India, is extremely high. Okay. So you have a very large amount of women going to these providers who are actually not registered medical practitioners who are providing medical advice. So misdiagnosis rates are very, very high if you go there. Now, if you look at actual medical practitioners, continuous learning is not a thing. Whereas gynecology is an evolving field. And today, more women are having long term chronic lifestyle problems than they had at any point of time. And using your medical textbooks that you have learned from 20 years ago, 30 years ago to diagnose people today without bothering to be updated, then I mean, I'm not talking about numbers, but the misdiagnosis chances are pretty high. And thirdly, the way that medical systems are set up today, you have doctors are unfortunately, there's a severe supply demand mismatch. Doctors have very little time to be able to devote to patients, especially when they're complicated cases. They are like, they are overburdened by the kind of patient load that they have, and hospitals are not as technologically sophisticated as you would want them to be able to manage follow-ups and continuing care. And so again, the diagnosis chances are high. There aren't any studies that are published about like, okay, x% misdiagnosis hai, but when Pinky Promise put together a whole bunch of data, and we also corrected for the fact that when it comes to women's health issues, people tend to underestimate thresholds of pain in women and also not take a lot of their symptoms seriously. We realize that it's a whooping, like nearly 1 in 2 cases probably are being misdiagnosed today.
Right. So the problem is on the like a two-sided problem, right? The problem is the doctors don't have the time to learn and to have the latest advisory available to them, and for the patients to access those kind of doctors who have the space to give the right diagnosis. Both
Yeah,
space and the learning.
yeah, I think it's both. We have so many incredible doctors who are putting themselves out there and are doing whatever they can to be able to give the best quality of care to patients, but even they are not as equipped as they should be to be able to provide the best care possible.
And so, considering this problem, so like your choice of using a technology and AMI, now the AI is a buzzword, but I think you started before the AGI revolution came into the practice, right?
We started before people started, like we started well before the LLM revolution. We started before it was easy to actually bring in AI ML. We started when AI ML was a lot more rudimentary than it is today. But obviously, like at that point, we were trying to prove our product market fit. We didn't bring in any AI into our product till we were sure that that's what we needed. AI wasn't necessarily something where like "नहीं, AI का कुछ बनाना है, so let's build a women's health solution around it." It wasn't like that. AI actually came in as something that would solve the supply side constraints and the quality side constraints that we were actually facing, and make the unit economics of the business model much better. So that's why we chose to like bring in AI. But in the beginning, like the first year, there was just no AI at all. We had decision trees that we were using, more like if this then that sort of systems, which would actually help us get for the most simple FAQ type of issues. It will give you a very good understanding, and the doctors can sign off on that. So doctors say that yeah, of course, this is the right rules that have been followed to arrive at this understanding. तो हमने इतना तक ही किया था, उसके बाद ही सारा एआई सब कुछ किया है.
And coming to the solution, like what was the journey of the solution? How did you start it? Like this is what we tried first. How did the product evolve? What did you learn? Like, can you share insights on that? Like, how was the first hypothesis and how it evolved in your journey?
Um, okay, so that's been really interesting for us. Thank you for that question. So, the way that it started was we were like, okay, women are going online and searching for their symptoms. Now, if you go online, you get a whole bunch of long form articles. तो हमने पहले ये चालू किया था कि ये लॉन्ग फॉर्म आर्टिकल्स किसी को समझ में नहीं आएगा. नो वंस गोना अंडरस्टैंड इट. लेट्स बिल्ड आउट अ सिचुएशन वेयर वी कैन एक्चुअली decompose those long form articles into easily understandable question answers and forms that people can fill to be able to get answers. And let's also use a lot of evidence to supplement what's missing and really personalize. So we built like a conversation flow. And the first thing we did was we actually tested that on WhatsApp and on Facebook by me mimicking a chatbot, getting prior consent, mimicking a chatbot and talking to a few hundred women to figure out number one, are they completing the flow? Number two, is this information something that's actually valuable to them? Right? So, like, the information should be valuable. If the information is not valuable, then they're not going to do anything with it.
And now, are they trusting you with the information also? No?
That
Like
exactly
random,
is there trust? Are they likely to then engage more, ask more questions, be invested in the information that's provided to them? Do they believe it to be a credible form of conversation? And we were also like, see, everything that we were doing before Pinky Promise, people were using a lot of voice and video. So COVID happened and people transitioned into voice and video calls for healthcare. So a lot of the upcoming telemedicine solutions were largely leveraging voice and video. And we had a hunch that that was probably not the best for women's health because women don't have the privacy in their lives to get on a call and say my periods are delayed, my vaginal discharge is weird, I had a history of sexual intercourse, things like that. You know, which woman is going to say that on a phone call or on a video call? Like, nahi bolengi. Even if she's alone, she's
right,
not going to say it.
right.
And it takes a lot to be able to get her to cross that point, and that's a time suck. What we realized was women are very forward in typing these things out. So we
Ah,
did an A/B
interesting.
test also to figure out whether a text-based chat-first solution is the right way to go. And obviously, all these things were proven out. We realized that they were significantly more truthful about their symptoms and medical history when they were made to chat about their symptoms than when they received a call about their symptoms. Second thing is we realized that this is a model that actually works. People are completing questions. Sometimes when a test was told for them to do, wo test karke, they would share the report, say that, yeah, I'm anemic. All these interesting things were happening. And so we were like, okay, we're ready for the next step, which is we built like a basic beta version of the app. We put it out on Android. So Kotlin may we had built a very very basic, very like rudimentary edition of the app. We didn't have any doctors, and we were wondering if a chatbot was enough, right? Like a content play without a doctor in, where you could give them a likelihood analysis. Is that enough to solve people's problems? And why would they then want to pay for a doctor? Interestingly, we were of course proven wrong because people were not happy to talk to a doctor at first, right? So most women were happy to fill that anonymously, jaake, like in a bit of a faceless manner to finish a chat and actually answer questions. They were more than happy with. That was working for them. Okay.
Probe this one more, this anonymous chatting thing. So when they are doing this, when you initial iteration also, were they sharing their ID also? Like because they are
No,
not
they were no.
safe in
So we would
talking.
not take any of that information till they actually finish answering the questions. So till we
Okay,
needed to give them a prescription, we don't need any other information. We need some basic things, but no deeply identifying information is required. We need your age, your LMP, your date of birth, your height, your weight, your gender, of course. But we don't need to know कि तुम्हारा नाम क्या है, तुम कहाँ से हो.
right,
We don't need any ID proof at that point of time. So we didn't take it. We actually worked a lot on analyzing our data flows to figure out what is the best way to actually ensure that we're building trust and getting high completion rates. But before we went into all that, that was an interesting fail actually for like 5 months when we after building this bot kind of an app when we spoke to women. They would say, "ये सब ठीक है. Thank you so much. I've downloaded your PDF with the likelihood analysis, but doctor कहाँ है? I want to talk to the doctor." Because once they finished answering some questions and they realized कि problem है, they wanted to talk to a doctor. And so we were like, okay, great. And we built a system for the doctor to then be in the loop. Again, we piloted that out. So this was 2023 when we piloted that part out. And that really took off. So for very simple issues, we had a doctor in the loop. Once we brought doctors in the loop for a few FAQ type of issues. So let's see, like vaginal discharge problems, the urinary infections, and then we had things about family planning and birth control. We put those up, and it was more of like a decision tree that I talked to you about. And at the end of it, it would lead to an end outcome because there were very small number of issues to consider. They were quite exhaustive set of questions could be asked, and decision trees could be built, very linear sort of decision trees. And the doctors would then get a basic understanding of this is what the conversation was. They could ask any further questions that they want, but they would say that, okay, the conversation has been completed. These are the kind of symptoms that the patient has had. These are the medical history of the patient. And this is what probably should be the diagnosis and medication. Then they can approve it, edit it, talk further to the patient, ask whatever they want, do whatever they want. But that really took off. So organically, without spending a single rupee on any form of marketing, about 5,000 people, 6,000 people just used it. And every one woman who would come onto the app, we would talk to every single one of them and get feedback. Ki, what has worked for you? What has not worked for you? We spoke to every single person. Even people who dropped off, we would try and call them up and we would try and get feedback. Ki, like, kya kar sakte hain? Do you still want to have a conversation? Because clearly you've had a problem. That's why you've come. Do you want to just talk to the doctor about it? We learned so much about the UI UX, about the care experience, about the kind of questions we were asking. We learned so much about everything. But I think what it proved was with almost no money at all, people were coming, they were willing to trust the platform, they were willing to pay. And a lot of the profile was actually tier 2 tier 3 women from below middle class backgrounds. ऐसे ऐसे लोग थे सबसे ज्यादा जो आ रहे थे ऐप में. um, and that
Because they
actually
might
was.
not have the access to quality healthcare actually
Yeah,
at their
and we
places.
also had a lot of rich women coming. So a small proportion of them because it's convenient, right? Like the problem of stigma and taboo doesn't escape income quartiles, is what we tell people, right? Well, like it's still stigma, it's still taboo. Like you could be the richest, most educated woman, and you could still not be empowered when it comes to your sexual and reproductive health. And so the convenience of just being able to chat, not stepping out of any room, and at any point getting a diagnosis is basically what we could emphasize on. And that is what then we at that time launched a sprint. In 2.5 months, we wrote 20,000 plus lines of code. We built out and we trained us, like we were anyway training our AI at the back because we realized that like we can't stick to decision trees at scale. Like we have to build out more sophisticated software. So we were anyway doing that. And that was like a pretty lengthy procedure, but everything else apart from that, which is sort of the patient experience, making the app available on Flutter so that it could be on Android, iOS as well as web, all of this we just did, right? And that was a really incredible part of it all. Due to which, like literally in a year since we had launched that pilot with the doctor in it, we ended up having a we basically ended up scaling and launching a public version for everybody on all platforms, and that's what we started scaling really rapidly. Like that's what saw a lot of rapid scale with low CAC. Like we were just able to see that, and it's been a year since we launched that version. It's been exactly a year actually.
Oh, oh nice.
Yeah.
So one of the things I was like, in the journey now, the patient doesn't have a consultation with doctor like a video consultation,
They
audio
don't have
consultation.
a video or audio consultation. They just have a chat consultation. And that's the coolest part because we do have like a voice call with the doctor available for issues where we have not yet built our technology out for. We are noticing that people are only choosing voice call option for those. So anytime you chat and you say I have this particular problem, you have a choice. You can choose a voice call or a chat. You have anything is available. People prefer, like we're living in an instant culture, and that's something that like a lot of organizations don't seem to reckon with. Like everybody wants everything instantly, especially healthcare actually. Like that's your biggest pain point, right? Like don't you want a solution instantly? Don't you want to know what's going on? So the fact that you can chat instantly with a doctor and not leave your room, not leave your space, not worry about anything. People have gotten prescriptions from Pinky Promise in the middle of their classes, in the middle of board meetings. They've done it in the middle of like their family का शादी चल रहा है और मैं पिंकी प्रॉमिस में साइड में बात कर रही हूँ क्योंकि किसी ने बताया है. All these kind of things have gone on at Pinky Promise, which has been unimaginable hitherto because of the chat convenience. Although we have voice, it's just like literally like 5% of population comes and pays for voice. Most people prefer to pay for chat, and we're actually working on expanding our options and working on our software such that almost all the symptoms are covered by chat. So even if they require a little bit of manual intervention by the doctors, because some things are a little bit more qualitative in nature, it will still be sorted out by chat.
Like I was thinking, it's very counterintuitive because we are like a sort of such a oral society in many ways. Like we will call the Uber driver, we'll call the Ola
Yeah,
driver
yeah.
when even like, and we want to talk to feel the trust, right? But in this space where trust is so critical,
It's two things
it's
actually.
like
It's not just the space. It's also the generation that we're talking about. So younger
hmm,
women and younger people nowadays कौन phone call करता है?
hmm,
Nobody phone calls, right? Everyone's just chatting with each other, and they are like, people are averse to picking up phone calls. It's only when you have a certain degree of intimacy with somebody that you would just pick up the call and call even your friends these days. So that's what we're observing in young people. People don't phone call anymore. That's one thing. And so that's not the predominant behavior. Behavior is just chat, even voice notes, but not phone calls. And that's one thing. The second thing is that, when have women ever spoken using their voice about these issues?
hmm.
When have they
Yeah, this is
spoken
very
about
true.
this? Right? Like even me, right, in the beginning, when I was pitching Pinky Promise to people, I would hesitate to say the sexual and reproductive healthcare keywords. I would hesitate to say it. And I'm like, "मैं एक company बना रही हूँ," like, and I'm hesitating to say it. Like, how is somebody going to pick up a call and talk to a random person, even with the best of qualifications? कैसे करेंगे? That these are all barriers to entry, right? Like these are huge barriers. And so understanding somebody's real behavior and building basis, that is what we pride ourselves on doing at Pinky Promise.
And I think text is that safe space to have that conversation. Then and you get that, yeah. And
Safe
now
and
it makes
bhangar free, right? Like if I could have text conversations to do, like I am nowadays also that kind of a person. I'm happy to like have conversations to book things on WhatsApp. Like everything is going on to WhatsApp and text based modules. And all companies are also doing the same thing. Like they always have a widget out there as opposed to a call us widget, right? They have a WhatsApp widget. It's because of the predominance of this as a mode of communication.
and can you shed some light on the segment, right? Is I'm assuming this segment which is comfortable in texting will be urban women in that 20 to 36 space.
Yeah.
But does it right now, because you are also in initial stage in like building,
Yeah.
but do you think you will also expand to segments which are more vernacular, which are regional languages, either through text or through calls? Like, what are you thinking about the other segments which are being excluded right
Absolutely,
now?
absolutely. I think one interesting observation is a lot of people have asked us whether do you have to build something different for rural India? And interestingly, our answer has been no, because of late, for the past 3, 4 months, we've actually had a high volume of women coming in from more rural locations and rural IP addresses. So it's about like 12% of our population today. And when we do our user phone calls with them, they are actually as comfortable with chat as an option compared to any other option. So I think the
Right,
model works. The model for like chat works because I think that when you look at women who are beyond 35, 36, who've never had, like many of them have actually just not had an opportunity to be literate, an opportunity to read and write, an opportunity to go to school. Younger girls are actually leading the revolution in their homes when it comes to adoption of technology, even in
right,
rural areas. I think that's a very, and they are the ones who are hand holding their mothers, their fathers, and the elder ones in their family to actually use technology.
right.
So that's an interesting thing that we realized. And the second thing we realized is smartphone penetration is only going to increase.
Yeah,
And so more and more of like, we don't need to change our behaviors to be more accessible, but like the rate at which the penetration is happening is such that we don't need to. Otherwise, we would have considered it. But when it comes to language, I think that's a huge barrier today, and it's something that we've already recognized. So, a lot of women who come to Pinky Promise drop off after they see wordy questions in English. Obviously, English is not something that they are comfortable with. So we've actually first thing we did is let's simplify that, right? Let's simplify it so that somebody who's kind of literate in English is able to also understand and work on it. I don't think we're fully there yet. We're working on it. But the second thing that we're doing is in a month, we are actually launching a Hinglish version of the app. Not Hindi, but Hinglish. Not in the Devanagari script. Because young women are as unfamiliar with the Devanagari script as they are with complicated words in English. So we realize this, and when we actually have like once you get a prescription, you can continue to chat with your doctor and ask follow up questions. And when we
Right.
analyzed how people were asking follow up questions, we realized that most of those questions from the northern belt just came in English. They were not in English, they were not in Hindi, and they were using a lot of words to describe reproductive healthcare body parts, which were in English with a lot of Hindi strewn in, right? And then we did a lot of other beta tests by just making like a come and doctor se baat karo. So we floated ads in English, Hindi to figure out whether this is just a sample, biased sample that we have of people who are already coming onto Pinky Promise. Like हम क्या कर रहे हैं, right? To understand that, हमने क्या किया था कि we had just launched some ads in Hindi and made people actually chat with the doctor free form. No bot triggered questions, nothing, right? Just free from chat karo so that we could get a pure unadulterated version of what that conversation could look like.
Right.
And
Yeah.
it was all largely in English. So then we used all of that input to actually do an LLM based translation and then did a human layer on top of it. And we're actually done. We're in the process of testing it to launch it soon. And that I think is going to significantly improve our market penetration with people who are otherwise unfamiliar with English. And that would be a good way for us to then start becoming available in the vernacular, but not in the pure vernacular, but in vernacular in ways that people actually access them. Um, like I think you also asked me about our target or like our audience. Where are they coming from? What are they doing? So more than 70% are from tier 2, tier 3, tier 4, and smaller like emerging towns and rural areas that are like zilla panchayats and headquarters and things like that, right? So these are the kind of locations that people are actually coming in from. Of course, a majority amongst that continues to be amongst tier 2 versus say 3, 4, and others is a predominant amount of people in tier 2. But increasingly, as we penetrate and as we adopt a more regional language sort of strategy, we are hoping to be able to attract women who otherwise would not come to us because it seemed like a very like Angrezi thing.
I have some questions on branding, but I want to pick one thing you said. Is like follow-up questions, right? Normally when we go to doctors, even like I get my doctor digital, I have like 10 questions in mind, right, which
Yeah.
I get after the
Correct.
consultation.
Correct.
How do you facilitate
Yeah,
that, right?
that's the best part about Pinky Promise, I feel. Like, we realized it, okay? So, at the end of the day, outcomes are the most important thing for us. And
Yeah.
when we studied our outcomes, we realized that it's the adherence rates are about 60% in the beginning of Pinky Promise because then when you
Adherence rate, what do you mean by
adherence
adherence
rate is the
rates?
rate at which you actually follow through your prescription, right? Like, how
Okay.
are you really
Yeah.
following the prescription that's been given to you? And that's important because if you're not doing that, then there's going to be no improvement in the outcome. So we would call up every woman and say कि prescription has been given to you, like prescription मिल गया, आपने दवाई चालू किया कि नहीं किया? People would say नहीं, actually मेरे पास एक question है, ये है वो है. And that's when it struck us that like as women, when we walk out of the clinic, we have hundreds of questions. We don't have a mechanism to do that right now. So we very quickly built out a mechanism for women to continue to just stay connected to their doctors after getting the prescription, keep chatting and asking follow-up questions. And that's a window that you can keep extending using micropayments. So like 59 rupees is all you have to pay after 24 hours to keep extending your chat window. And so our 7-day retention rate at Pinky Promise, and I couldn't believe it when I heard it, it's about 96.4 percentage because women are chatting with the doctors. That's it. Like they're like, doctor, hey, I'm gonna chat with the doctor. I have a lot of follow-up queries. I've paid for this. I better get good care. So that's been our experience with actually making sure that follow up is good. And because of that, the adherence rate, which is a how many women are actually taking medicines that are prescribed to them, is at 91% today at Pinky Promise.
Which is pretty high than a
It's actually
normal
it's about
location.
3 times higher than the population. Yeah.
Right, right. And who would have thought like follow up,
That's
like
it,
have a
right?
direct correlation?
Yeah. Yeah, like just giving a
Right.
great prescription alone and diagnosing you correctly alone is not going to move the needle at all. It has to be
Right.
accompanied by a way for you to respect that authority, be bought into your care, ask questions, make sure that ठीक है, I'll be okay. 70% of the questions that we're getting on follow up is actually, Doctor, क्या ये serious है? Doctor, will I be okay? Is this something for me to worry about? But those are reassuring notes that one requires. Um,
Literally.
so yeah, like yeah,
And you need it from a doctor who's like sort of like
you trust that
prescribed, and you
person,
cannot
correct?
just give it a chat message. You need a person on the other side to say that to you that it's
Exactly.
okay, take
Like,
this.
don't worry a lot. Like, although everything is automated for us, like, it's still, there's still a touch there, right? Where the doctor is verifying that and saying that, yes, don't worry. Like, 70% of women get this at some point in their life. I've given you the medicines. You're going to be okay. Don't worry. Something like that. People are like, yeah, okay, fine. This is the best doctor. No one has told me this before. So yeah, all these things matter. They matter a lot.
Coming back to the branding, yeah, I'm always curious. Like, I was at Bangalore and we were following the startup because you went to Mulago, I think, right? And we used to follow Mulago. What's the story behind the name?
Oh, I think the story behind the name is just, it's like, what do you want a healthcare company for women to signify to women who use it, right? Like, it has to signify trust, and it also has to be a safe space. Women come to Pinky Promise to share things that they have not shared with their own partners, with their own families, with nobody. And to have a healthcare system that is actually able to do that is so important, because here is where we say that we just want to know this because we care for you and we just want you to get better. And everything that you tell Pinky Promise is safe, it's confidential, it's something that you can trust us. And so if you go back to young sort of um, childhood friendships, or when girls are at their ages of say 12, 13, and things like that, you look at young childhood friendships, something that they do to each other is they make picky promises.
Right.
These are unbreakable oaths of confidence. So that's what we wanted a woman to think of when they saw our brand, they saw our colors, they saw our logo. It should be friendly. It should make them feel like this is a safe space. It should make them feel like they can come to us and tell us whatever they want, and we only care for them to get better. um, I think that that's sort of why we picked it up, and we realized that women across, like even women who are not English speakers, right, like across India, that is a word that resonated with them, and so that's why we chose Pinky Promise.
And you mention in your like website there's a like I think it's key part of tagline also, judgment free empathy. And is this conscious to like because you see that as a problem, like judgment come as a problem in the consultations they are used to it as you're sharing in your experience also, right? So you want to put it out there that we are judgment free, empathy is there.
Yeah, so we
And
actually played around a lot with what is the right CTA for women.
yeah.
And we landed on this because we realized that in all the focus group discussions we had, in all the like studies we did, and also the A/B test where we had different CTAs, and we realized that women were reacting very positively to this. Clearly, because that's what they're looking for when it comes to a,
And that's what they face, they might already
most
face
likely
it
yes,
like they.
or they're concerned about facing that.
Mhm.
I mean, I feel like at the end of the day, we're all a product of the society, right? So even if a woman may not have faced a judgmental situation on her own, when she's heard of it and she knows that ye ho sakta hai, and she feels like everyone else in the society would behave certain way, they maybe expect the healthcare provider to also behave like that. A lot of new age gynecologists actually don't do that. We work with some fantastic gynecologists who don't do that. But I think for a platform to say that we represent this as an ideal is important.
Coming to this part, like the two-sided nature of your platform, right? One side doctors, one side patients. What are the things you're doing for the doctor side to make them so like they can quickly do it? Both the paucity of the time and having patients who can understand them well.
Yeah.
Like, are there any efforts to also educate the doctors or change the processes around the other side of the platform,
Yeah,
the
so I think
doctors?
honestly, we are not a two-sided platform. Doctors are just a part of Pinky Promise. We work with very, very few doctors to do a very, very high volume of work. So the way that Pinky Promise works is the minute a woman has a problem, she comes to our app. She clicks a button, immediately connects to a doctor. She describes her symptoms. Our software identifies what's going on. The doctor then triggers a whole series of automated questions that are asked to her to understand her symptoms and medical history. She then pays Anna. She's also able to commit any qualitative information that may have been missed out in the process. And at that point, the software actually analyzes everything and sends a doctor a prescription that the doctor can edit and send forward to the patient,
Right.
along with a summary of everything that's required for the doctor to actually make that decision. Because of this, one doctor at Pinky Promise is actually able to do about 100x the caseload that she would do even if she was in a telemedicine platform. And so I think that's the marvel of the model where we're not actually reliant on doctors for scale. But at the same time, the problems that you're actually talking about don't go away just because we have a system that requires much significantly lesser doctors to do exponential caseload. Because the doctors that are doing the work need to be doctors who are like constantly like they know the evidence, they are constantly updated, they have continuing education provided to them. There are ways for them to also seek expertise and expert references if required, because at the end of the day they are the diagnosing authority, right? So we have to make sure that we work, so we have very strict quality guidelines for who we onboard as a doctor onto Pinky Promise. Interestingly, for like the thousands of patients that we have served so far, we only have three doctors who are on duty and doing work at Pinky Promise, and they work in
Okay.
shifts. One doctor can take care of about 10,000 patients at scale in a given month. And that's the like really marvelous part of the technology. But we work on their continuing education. We also hire doctors who have a proclivity and excitement towards technology, who think that AI is actually really important for their practice. We and who are empathetic, who really care about their patients. And there are a lot of those kind of doctors.
Yeah.
So it's not been difficult for us to find great doctors to work with. And we also have mentors for those doctors, so that if there are any like complicated cases or anything like that, there are good amounts of mentorship and referral systems. Not like referral in the way that like, okay, I'm referring you here, not that way, but like somebody that they can go to for advice and stuff like that. We have all of those things for our doctors, and there's a continuous process of like learning exchange that happens, where based on the patients that come to Pinky Promise, doctors are constantly advising us so that the software and technology can be constantly updated and improved. The changes that they make, the tweaks that they make, the differences that they point out are really supremely important for us to do a good job. Secondly, we also have a system where when there are conferences or new papers or new topics, me and a couple of others are constantly on top of that to make sure that that's shared with the doctors and that's also fed into our technology. So these are all ways in which we actually control for quality at Pinky Promise.
This is interesting. But in this process, one of the things is we see is like medical records is also a big problem. It's not digitized, collected at same place. The patient is coming back, they will lose their receipt. There's a whole process going on by I think Koita Foundation in digitizing these records.
Yeah.
Are is that also taken care by the platform? Like if a
Yeah.
patient has
Yeah,
like
we
they have the
maintain,
records
we
will be
maintain
available to the
all her
doctor for the
records. Sorry, you're saying connecting back to her prior records?
yes, when a patient visits again, does the records like the medical history is there? Broadly, the medical history, which is also might be written and spread across different receipts and different formats. Like
Good thing is that that's not the case. We are like we handled like even if a person comes to us with significant medical history, all she needs to do is actually take a photo of it, or upload the files. We have multimodal capabilities, and so we are immediately able to read that, understand that, build out an analysis, add that to her medical file, and after she comes on to Pinky Promise, everything is with us. All her medical history is there with us, and also like the problem is often in the first consult, and that's the stage that we're at, right? Like most women coming to Pinky Promise are coming for their first consult, and so
yeah,
we actually do have a system for them to commit all of their priors so that we can whatever's relevant to them. Of course, it's never exhaustive, but there are a lot of medical history questions that are also asked, and for us, medical history isn't just a passive thing that sits there. It's something that we analyze and build on. So the next time she comes, if she has a history of something else and she's presenting herself with certain symptoms, our software is actually able to do a really good job of figuring out from her medical history what are the different trends, what could be causing it, And how does medical history actually weigh into your current diagnosis? Small things like if you have a family history of diabetes and you have PCOS, or you're missing your periods and things like that. PCOS is linked to insulin resistance, so it immediately flags that. Okay. Second thing is if you've had like a certain form of birth control, and you've told us that that's the case, and then there are certain other complications in your menstrual, period and things like that, we are able to do a better job. Similarly, like there are a lot of contraindications, a lot of things in your medical history and things that you've done that like certain medicines are severely contraindicated for those things. Our software actually figures out and doesn't prescribe those things. So there's a lot that we're doing with medical history that's not just like digitize kar diya. It's about using it to actually inform better healthcare for you.
Just follow up on this, like for the patients who require continuous care, and maybe a question too early in the journey of the startup, right? And
No.
like the chronic disease,
Yeah.
people who need not just the healthcare, the doctor care, right? The prescription, but you need a support
Yeah.
in terms of how to take your medicines, what diet to follow,
Hmm.
like a core course. Like, is there something around that right now, or how
Yeah.
are you thinking?
Yeah, I think that chronic conditions in women is actually very understudied and under understood. So what we've done at Pinky Promise is we realize about 40% of patients coming to us with regular infections or a singular missed period or something like that, because we have their medical history, we realize either they already have a chronic condition that's undiagnosed and we like ask them to take paths to actually diagnose it, like lab tests to diagnose it. Or the second thing we realize is even worse is that they are at high risk for something to happen very quickly. And so if a woman is coming to us with repeat yeast infections and she's not got a blood sugar test done, that's a huge problem, right? So about 40% of Pinky Promise is that it's women who either already have a chronic condition, diagnosed or undiagnosed, or women who are at the cusp of having one. And so what we end up doing at Pinky Promise is we've built out a co-pilot. So the minute that like there's a chronic care is not as much about giving a diagnosis as constantly staying in touch with you. And we realize that doctors in clinics are actually very ill equipped to do that. They can't continuously stay in touch with you. As much as they may want to, they can't do that. Their WhatsApp is going to go crazy. Their email is going to blow up. They just don't have a good system to immediately respond to things like, should I be eating this? Should I be eating that? What should I be doing? Suddenly, I'm feeling like, okay, there's a black patch over here. What do I do about it? They can't. That's why you go to tools like ChatGPT and ask all those questions, because doctors can't actually answer that for you real time. But we're answering that for you real time because our co-pilot does that for you. So the co-pilot prompts the doctor with the right answers, and we have service level agreements with our doctors to be able to verify and give that answer like in minutes of someone asking that. And so we actually have, and we're going to launch that soon. We're in the process of testing it out, figuring out how that works. And very soon we'll actually have a mechanism to actually manage all chronic care using chat based things. And if you want, you can also book a voice call. All that is there as options. But people prefer sending pictures and doing chat based things. We also have a nutritionist who's helping us build out a whole nutrition model, that is going to be an accompaniment to the chronic care. So just like you would have, today you have a simple infection or you have a pressing problem and you want to get a diagnosis and a prescription for it, for chronic care, if you already have a diagnosis, you already have medical history, you can very quickly come to Pinky Promise, inform us of all of that, share that with us, and then just be in touch with your doctor. And every time you want to just have a chat, you pay a very small amount of money in the form of a micropayment, and you keep having that constant line of support. So that's basically what we're building out now, which is also something that makes business sense for us. Um, I think one thing I totally completely like missed out is now we're in the process of already providing that care, but we do it a bit manually. So we do it with voice calls and a sort of a digitized follow up mechanism. But for us, even that is manual, because truly not being manual is when you automate that.
Like sort of like nudges to do the right thing,
Yeah, all
like a
that,
cheap way
all that is there if you have an app and we know what you need to do, right? So we'll know whether
to.
you've taken a walk today. We'll know whether what your
Yes.
stress levels are. Are you sleeping? Are you not sleeping? Like we can easily connect to all these devices, and we're able to get the data. So step trackers on Android, sleep trackers on Android, the
Mm.
same trackers on iOS, having a inbuilt period tracker as well on Pinky Promise. These are all like very easy additions to our technology that we're actually working
Mm.
on doing right now, because the core, the hard part, which is demonstrating and building out systems to diagnose you on chat, is already done.
Yeah, we are also thinking like if the trust is already established, so the next step is providing more services
Exactly.
to the
We want
same
to see,
person.
we want to move somebody from reactive care to preventative proactive care. And that's the objective, right? Like if you have healthier women, I mean, eventually that, if we can just shut our business down and say that, okay, every woman is healthy, she doesn't need Pinky Promise anymore, I'd be happy to do that. I think the idea is we move a woman who comes to us because she has a discharge problem or a UTI or an unspeakable period condition or something like that. She comes to us with it, but then because if she's giving us her medical history, because we know a little bit about her, we're able to move her on a bit of a preventative healthcare path. And we are there for her whenever she needs us. So that's the plan, and the insights from the data that we already have is going to really help us enable her to live a better life.
And considering all this journey, right, what are the future plans? Like, are you thinking also going across country? I'm in Africa right now, and I like see this can work here also so well. And like, what are you thinking? You have like product roadmaps, but
Yeah.
tell me both about the geographies you are thinking and the product roadmaps you have.
Yeah, so I think, see, Pinky Promise is a global problem. Eventually, we see ourselves integrated into every woman's device across the world, right? So that's sort of how we see Pinky Promise, or we see like our technology integrated into every woman's device. But for now, we're very early in our journey in India. There's a huge amount of scale that we need to achieve by just focusing hard on India. 20% of our customer base actually is already international. They come from not just sub-Saharan Africa. So sub-Saharan Africa and West Africa are a huge, like we get a lot of women from Togo, from Senegal, from Ghana, from Nigeria. We have South African, we have Kenya, Tanzania. These are all like a very large proportion of our daily like user base does come, like about 20% comes from sub-Saharan Africa, as well as from interestingly from a lot of Middle East, the Middle East, as well as North America and Europe, only because in North America and Europe, people want a second opinion from an Indian doctor, or they just have really long wait lines to actually see a doctor. So they want to know what's going on. We're really interested in market expansion. We feel like it could be done in a few ways. We have a few hypotheses for that. But right now, at least for the next year, like we just need to hunker down on India and get to a point where at least every Indian woman knows about Pinky Promise, and she doesn't have to like see an advertisement or see something about us to know about us. She already knows about us. So we want to make sure that that's the case in the next year.
Yeah, and there's a problem in India is so huge
It's
across
so
class,
huge, yeah.
across geography.
It's so huge. The model is working really well. We have an excellent funnel. We have good numbers. So we just want to double down on it, and we don't want to distract ourselves going into geographies and circumstances that we just don't know enough about at this point of time.
And are you also thinking about the knowledge and the which you are sort of like creating as you do this and in public health and there is is there any plans to create products, awareness products, knowledge products around this so that it can be shared? Because that's also a problem, right? We don't know where to trust and what is the right for particular geography or suited to the context.
Yeah, I think yes, 100%. So there are a lot of sexual and reproductive healthcare concerns and questions which don't require a prescription or a diagnosis. So we're in the process. So we already have that built out, but today it's all information that's disseminated through a doctor. So we're actually building out a system where you can get some information on Pinky Promise itself for free for some of these questions, right? Like how do you put on a condom the right way, or like what about allergies, or people have a lot of questions about birth control even once they've decided that they're going to sort of use birth control. People want to like just some information about reliable information about the plan B, all these kind of things. We have answers for it already, but it's all doctor driven and doctor verified. But to be able to just chat and get that, like just like you would ask Grok or ChatGPT, but like much better quality of data, much better training, like that's something that we're actually working on. Number two, something that we are really interested in is there are so many doctors who actually approach us every day to ask how they can be affiliated with Pinky Promise. They've heard about how easy it is to manage care and follow ups, and they want that for their practice. So we're actually in the process of building out something that's going to be an add-on to our Copilot, where with enough medical history prompting, like if the doctors are able to just feed in, being like, patient is so many years old, this is her situation, they can actually have a conversation with our database to be able to like understand what they need to do with that patient. So it's very easy for them to have a double check on whether this is the right way to proceed or not. And also, like, they can generate prescriptions and send it to that patient and things like that. Like, they can do all of these things.
Like a product targeted at
Doctors,
doctors
yeah.
primarily. Yeah,
We
this
think
is
about
good.
it. This is again like nothing at Pinky Promise happens without launching it in a very light manner, doing some hacky experiments to figure out whether it works or not. But these are all some really interesting things that we have some early data about that we're like super excited to get on top of.
I didn't touch on this. Like, how is the team? How is the team shape up? What kind of team you are building
Oh
right
yeah,
now? How has
yeah.
been that? I mean,
So our team is honestly, it's been the most incredible thing for me to do at Pinky Promise, is to work with such a cool team. My like I of course take care of a lot of the business, the healthcare components of it. My co-founder Akanksha, she's the CTO of Pinky Promise. She's about like 12 plus years even before coming to Pinky Promise on building a lot of like AI targeted at healthcare. So she's the right person to handle that component completely. And we have a really wonderful and small, like a team of about 5 women outside of that who are taking care of customer support, who are taking care of content, who are taking care of like outreach and sort of customer discovery, and who are taking care of the research and development and training of our models. And then we have doctors that we actually work with who have sort of retainers with us to be able to like to be exclusively available during the times that they are on Pinky Promise, and take care of patients at that point of time. So this team is really small because we anyway automate everything. We don't need a very
right.
large team. Um, like I think that for companies like ours, technology is often the biggest bottleneck, and so is health, like medical knowledge and expertise. But luckily, like you have that in the co-founders, so we've really figured out a very lean way to do it intentionally because that's the best way to build actually in the beginning.
Yeah, like more like
Otherwise, the
iteration
overheads
based.
are too much. Like the overheads are just too much. It makes no sense, and you're not using your resources in the best way possible. Like I think that till you reach a point of good profitability doing one thing, you just need to do that one thing very effectively, for which you don't need a lot of people.
And how many consultations you do right now
Yeah,
per month
so
broadly?
just last month we crossed about 2,500 consultations that just that month. And in total, like since a year that we've launched, we have totally actually completed close to 25,000 consultations on Pinky Promise. And we've also like catered to about 250,000 registered users. We have a lot of resources on Pinky Promise in the form of chat rooms and things like that, where they can sort of connect and get good information that's credible. Because not every woman who comes to Pinky Promise has an active infection, but she may have questions that are for sexual reproductive health that may not really require a doctor. So we have that as well at Pinky Promise.
Okay, so even if you don't think it's a health issue, just a query in your mind, you can just
You can
ask
come
Pinky
and
Promise
query.
chatbot it.
Yeah, so we have chat rooms where you can actually anonymously pose these questions and get responses to it.
So it's now like I see it's a spectrum, right? Like before even you have a full diagnosis, once you have a diagnosis, and maybe in the future, like if you have a chronic disease and you want it to managed and have continuous care, like the continuum of care throughout from
100%.
starting.
100%. And that's the beauty of like it being on your mobile. Like you can do all these things.
Yeah, and a trusted device, sort of like you can query and become your friend.
Yeah.
Yeah.
Yeah. That's the pinky promise.
They promise to you as a patient from
Yeah,
a,
yeah.
or maybe they are not patient, like they are just people who have queries, right?
Yeah, exactly. Yeah.
This is great, Divya. I think this was a wonderful discussion,
Oh, super.
and I've like learned so many things. Like especially, I have this in mind. I've worked in development sector, and I always see we are a oral society. We are more comfortable in talking, and the voice is the most trusted medium to communicate. But now, if this conversation is like,
Yeah.
yes, it doesn't really work that way. and it can be counterintuitive because voice identifies you when you talk to someone,
Correct,
right? You
correct.
can see your
And you may not
that
have
way.
the space to really have that conversation, and you may want a solution immediately. Yeah.
Right. Yeah, you won't have a space when
Now
you're
think
like.
about it, right?
I
Like
think.
Indian households ऐसे थोड़ी होते हैं that you have your own little room or something. You don't have that. You don't have that space. Woman is sitting in her room with her bhabhi, her mother-in-law, her mother. How are you going to just pick up the phone and say something like that? So I think that's, yeah.
It's a shared space always.
Always, always.
Like,
Yeah.
yeah,
I
it's
never,
always a
like,
shared
I
space.
wasn't given my own room. Like, it's not a normal thing in India, right? Like, it's a thing in other countries, but India में ऐसा नहीं है.
Yeah,
So, yeah.
yeah, interesting. Yeah, but great to have this discussion with you,
Thank
and
you.
probably I'll like sort of like catch up with you again in 1 or 2 years' time
I
and
would
how
love
things have
that.
gone. What we,
I would love that.
yeah,
And
and
it'll be
probably
interesting for me also. I said all these things. I wonder what it's going to look like, which
like yeah,
hypotheses
how
are
the
going to
journey
be.
shapes us, right?
Yeah, yeah, yeah.
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 Okay. Thank
Well,
you.
thank you for your questions. Thank you for having this conversation. I hope that it was, you know, informative, helpful, whatever, even for you and your audience. Yeah. Thank you.
Yes, that was the idea, like to understand how this model works,
Yeah.
how you're tackling the problem.
Yeah.
Great.